Breastfeeding is a beautiful and natural way to nourish your baby, but for many new mothers, it can come with its challenges. One of the most common issues is sore nipples. Here's a comprehensive guide to help you understand the causes, preventive measures, and effective treatments for sore nipples while breastfeeding. Sore nipples can be caused by several factors, including improper latch. One of the most common causes is the baby not latching onto the breast correctly. Dry skin. Frequent breastfeeding can lead to dry and cracked skin on the nipples. Infection. Conditions like thrush, a yeast infection, can cause sore nipples. Engorgement. When breasts are too full, it can make latching difficult for the baby, leading to soreness. Friction. Tight bras or nursing pads that are not changed regularly can cause friction and irritation. Preventive measures. Ensure proper latch. Make sure your baby's mouth covers a large portion of the areola, not just the nipple. Seek help from a lactation consultant if needed. Frequent nursing. Breastfeed often to prevent engorgement and ensure a proper latch. Maintain hygiene. Keep your nipples clean and dry. Change nursing pads regularly to avoid moisture buildup. Hydration and nutrition. Drink plenty of water and maintain a balanced diet to support skin health and overall well-being. Avoid harsh soaps. Use gentle, fragrance-free soaps to clean your breasts to avoid irritation. Effective treatments. Lanolin cream. Apply pure lanolin cream to soothe and protect sore nipples. It's safe for the baby and doesn't need to be washed off before breastfeeding. Breast milk. Express a few drops of breast milk and rub it into your nipples. Breast milk has natural healing properties. Hydrogel pads. Use hydrogel pads to provide instant cooling relief and promote healing. Warm compresses. Apply a warm compress before breastfeeding to help with milk flow and ease discomfort. Cold packs. Use cold packs after breastfeeding to reduce swelling and pain. Pain relief. Over-the-counter pain relievers like acetaminophen or ibuprofen can be taken as directed to manage pain. When to seek help. If your sore nipples persist despite trying these remedies, or if you notice signs of infection such as severe pain, redness, swelling, or fever, it's important to seek medical advice. A lactation consultant or healthcare provider can help address any underlying issues and provide personalized guidance. Support and encouragement. Remember, you're not alone in this journey. Many new mothers experience sore nipples, and it's okay to seek help and support. Reach out to breastfeeding support groups, friends, or family members who have gone through similar experiences. Breastfeeding can be challenging, but with the right knowledge and support, you can overcome the difficulties and enjoy this special bonding time with your baby. Take care of yourself, stay patient, and give yourself grace as you navigate this new chapter. Thanks for watching, and please subscribe the channel.